In this video, we want to cover seminoma. Okay, it's the most common type of germ cell tumor. Germ cell tumors themselves are the most common types of testicular tumors. Now, in seminoma, you have two types, the classic seminoma and the spermatocytic seminoma. Again, the classic seminoma is the most common, correct? Classic seminoma can simply be called as seminoma. Is this fine? So let's deep dive into seminoma. Seminoma is a germ cell tumor. It's the commonest malignant tumor of the testis. Spermatocytic seminoma is a variant of the classic seminoma. Now you should note that the female counterpart of seminoma is called as dysgerminoma. So what and all have you studied so far? It's a germ cell tumor. It's the commonest malignant tumor of the testis. In females, it's called as dysgerminoma. Seminomas can be two categories, classic and spermatocytic. Okay. Undescended testis harbors seminoma because probably it is inside the body. The testis has not descended. So probably it is detected at a later stage. So normally undescended testis, they harbor seminomas. And that's it. That's it. Wow, good. So that's all we have to learn as an introduction. It's a germ cell tumor. It's the commonest malignancy. Malignant. So it's malignant. Remember, let's make this word red. It's malignant. It's a malignant condition. It's a malignant condition, and there are two types, classic and spermatocytic. Spermatocytic has better prognosis. In females, it corresponds to dysgerminoma. Okay, spermatocytic is more having better prognosis. Can we retain that information? Spermatocytic variation has better prognosis. Undescended testis harbors seminoma. Not always, but they tend to harbor. They tend to harbor seminomas. Now let us look at the classic seminoma gross, and then we want to look at the microscopy. Okay, in this video, that's what we are going to look at, gross and microscopy. Starting with the gross. The testis is enlarged to 10 times of the normal size. Oops, 10 times of the normal size. So it's enlarged to 10 times of the normal size. Is this color okay? 10 times of the normal size. It tends to maintain normal contour. Interesting, because the tumor never invades the tunica. The larger tumor replaces entire testis, whereas a smaller tumor appears circumscribed mass in the testis. So if there is a large mass, then it will replace the entire testis. If it is small tumor, it appears as a circumscribed mass in the testis. Okay. Cut section. What will you see in the cut section? Homogeneous, grey-white, lobulated appearance. Homogeneous, it's written here, see, homogeneous, grey-white, lobulated appearance. Okay, let's move on to the microscopy. Just a wake-up call. Do you know where we are? We are studying testicular tumors, seminoma. In that we have finished the gross morphology, where we saw homogeneous, grey-white, lobulated appearance in the cut section. Okay, before cutting, what and all you saw? You saw that the testicle size has increased to 10 times, but the contour has not been lost because the tumor does not invade the tunica. Okay. Now we are going to move to the microscopy. Microscopy has been divided into two parts, tumor cell and stroma. Okay. So first let's start with the tumor cell. The tumor cells, they lie in lobules, okay? So that is the first word here. They lie in lobules. Now coming to the tumor cells, each of them, they are uniform in size, they have clear cytoplasm, well-defined cell borders. Now, the cytoplasm you can stain it with pass reaction. Okay. Now, coming to the nuclei. The nuclei are centrally located. They are hyperchromatic. They are large nuclei, obviously, because it is a malignant condition. The nuclei are large, hyperchromatic, and they contain prominent nucleoli. Okay. The tumor giant cells may be present. Okay. Tumor giant cells may be present. Mitotic frequencies are not usually present, but if there is anaplastic seminoma, then mitotic activity will be there. Okay. In anaplastic seminoma, mitotic figures are present. Okay, in anaplastic seminoma, mitotic figures are present. Fine. I think we can now move on to the next part of microscopy, that is stroma. Now look at stroma. The stroma of seminoma is delicate fibrous tissue which divides the tumor into lobules. So stroma is doing what? It is fibrous stroma. The fibrous stroma is dividing the tumor into lobules. Look at this diagram here. Can you see this dark pink boundaries? This is the stroma which is lobulating these tumor cells. And these stroma are showing lymphocytic infiltration. So it shows that there is immune reaction here. Granulomatous cells are there here. Fine. So the stroma is fibrous. It divides the tumor into lobules. The stroma shows lymphocytic infiltration indicative of immunologic response of the host to the tumor. They show granulomatous reaction. Fine. That covers the microscopy, guys. Next, we should learn spermatocytic seminoma. See, note that in germ cell tumors, seminoma is most common, but it has good prognosis. Okay. And amongst the classic seminoma and spermatocytic seminoma has better prognosis. Okay. So, seminoma also has good prognosis. Don't worry. So, we can add that here. Spermatocytic seminoma has better prognosis. Seminoma has better prognosis than other germ cell tumors. Spermatocytic seminoma has better prognosis than the classic one. Okay. So, let's revise then. Where did we start? Okay, here. From here we have to start. Seminoma is a germ cell tumor. It is one of the commonest malignant tumors. In females, it corresponds to dysgerminoma. So, seminoma is divided into two main categories, classic and spermatocytic. Seminoma has better prognosis than other germ cell tumors. Guys, is it clear or you're feeling sleepy? Okay, spermatocytic seminoma is having better prognosis than the classic. Undescended testis usually tends to harbor seminoma. Coming to the gross, the testis is enlarged to about 10 times the normal size, but the contour is normal because the tumor rarely invades the tunica, but it is a malignant condition, remember. The larger tumor replaces the entire testis, smaller tumor appears circumscribed mass, like a circumscribed mass. Cut section will indicate homogeneous grey-white lobulated appearance. Microscopy of the tumor cell, it is lying in lobules. These cells are uniform in size, cytoplasm is clear and well-defined cell border is there. The cytoplasm contains variable amount of glycogen and it is stained positively with pass stain. The nuclei are large, centrally located, hypochromatic, and they contain 1 to 2 prominent nucleoli. Tumor giant cells may be present. Anaplastic seminomas will show mitotic figures. Now let us look at the microscopy of the stroma. We have finished the microscopy of the tumor cell. Now let us look at the microscopy of the stroma. It is fibrous. It divides the tumor into lobules. and it will show lymphocytic infiltration. Sometimes there can be granulomatous reaction that covers seminoma. So easy. And seminoma has been asked so many times that if you know this much, you will really get good marks. Coming to the second type of seminoma, spermatocytic seminoma. Let's look at this in the next video.